but we have responsibilities for the future. And I better shut up or we won't get to the panelists. The first panel is on health, and Jack Kloppenberg, excuse me, I'm already getting mixed up. Robert Craig will be moderating that panel, and I'll let Robert introduce each of his panelists. Robert has been very active in trying to get healthcare reform. He was active with the SEIU. He's very much involved. He's a Citizen Action Director, Citizen Action of Wisconsin, does a fantastic job of it, and has been a very able and active union member, a very able and active community member, and a very able and active person in trying to get change. So, Robert, I guess you're next.
My name is Robert Craig, as Gene said, Executive Director of Citizen Action Wisconsin, and we will give brief 8-minute or so opening statements and then try to leave as much time as possible for conversation with you, but to lay out a number of perspectives on health. And as you know, Gene and Linda Farley spent their lives dedicated to establishing healthcare as a right. I can remember as a young organizer traipsing around the state of Wisconsin with them with their single-payer PowerPoint in every nook and cranny and borough in the state of Wisconsin. So, and Gene has been on the Citizen Action Wisconsin board for at least 2 decades, maybe even longer, but a long time, longer than anyone can remember. So, has played a huge role. So, I want to, before I turn it over to the other panelists and we give our opening perspectives, just for those of you, how many of you were here last night, Friday, and saw Josh's presentation? So let me try to link those together, because Josh made the point that traditional economics, right, is an appropriate way to think about morality and what kind of community and what kind of humanity we should have, and that there are higher values that obviously it doesn't select for. In fact, it actually encourages and promotes and rewards greed in an irrational way that will destroy the planet. Now, a similar thing is true with healthcare. Especially in the United States, where we've built a system that's based on healthcare as a profit, as a commodity, as something to profit off of, rather than as a fundamental right. And as a result, over the years, we've created a system that is the most expensive in the world, double per capita than any other country spends, and a system that is also has poor outcomes. I think we're 37th in the world in terms of outcomes, and the disparities, which a number of the panelists will talk about, are horrendous. In other words, those outcomes are not even, they're all over the map. And so for people who do not have access to health care, which is a growing number of people in our society, and people all throughout their lives will face insecurity at some point because of the way our economy is set up and our healthcare system is set up, it's horrendous. It's much worse than 37th in the world for those people. So part of the reason for that is, quite frankly, if you go back a little, is that the United States, first of all, is the most individualistic of the advanced industrial countries. And also we have a very kind of conflicted view of government and the role of government. It's like we never forgot, we don't never remember that King George is not running the country, that it's our democracy. And so that has been a narrative throughout the history of the United States. So it's been harder for us to establish something like healthcare as a social good, as a public utility that everyone should have. And instead, it was done through employers, done in a piecemeal way. We created a fragmented system that has very expensive, very, very high quality specialty care for those who can afford it, but much too much of that, and not nearly enough of primary preventive care, chronic disease management, all the things that actually lead to good health outcomes. And